Minister, over to you.
Done. Thank you. Deputy Minister of Correctional Services, Kosi particularly Olomisa, who is joining us from Umtata in the Eastern Cape. The National Commissioner of Correctional Services, Mr. Arthur Fraser, who is here with me. The chairperson of the National Council of Correctional Services, Judge Cyril Desai, who is joining us from Cape Town, members of the media, and people at home. The COVID-19 outbreak, which was first detected in Wuhan, China in December 2019, has been spreading rapidly worldwide. On the 30th January 2020, the World Health Organization, led by the Director General, Dr. Tedros Adhanom, informed the world that COVID-19 was a public health emergency of international concern. On the 12th of March 2020, the World Health Organization escalated their alert and COVID-19 outbreak was declared a global pandemic. On the 25th of March 2020, President of the Republic of South Africa, His Excellency Mr. Cyril Ramaphosa, declared a national state of disaster in terms of the National Disaster Management Act. Comparatively speaking, other institutions nationally and worldwide discharging the risk of people within their province of responsibility, close off their facilities, and send people back into the community. This is not something the Department of Correctional Services can do with ease, simply because the interests of justice and society demand the complete opposite from us. The DCS has continually adopted a conscientious approach in implementing its COVID-19 disaster management response strategy across all its centers and offices. This strategy entails prevention, containment, treatment, and recovery. We are confronted, however, with a glaring impossibility of maintaining physical social distancing in our centers due to overcrowding. The United Nations High Commissioner for Human Rights, Ms. Michelle Bachelet, has advised that under international human rights law, states are obliged to prevent foreseeable threats to public health and ensure that all who need vital medical care receive it. Over and above that, the United Nations Standards Minimum Rules for Treatment of Prisoners, also known as the Nelson Mandela Rules, set out measures to protect those in detention. The High Commissioner Bachelet also advised authorities to look for ways to release people in detention, more in particular low-risk offenders and those who are at risk of contracting the virus. These include the elderly and those with serious health conditions. These are guiding international instruments as far as possible. Our own Constitutional Court in the matter of Lee versus Minister of Correctional Services reminds that prisoners are amongst the most vulnerable in our society to the failure of the state to meet its constitutional and statutory obligations, and that a civilized and human society demands that when the state takes away the autonomy of an individual by imprisonment, it must assume the obligation inherent in the right to conditions of detention that are consistent with human dignity.
SABC or DSTV 404, that is our SABC News channel, will stay with this briefing with Minister Lamola while we take continuing with the SME on point on SABC 3.
From rapidly multiplying in our centers, we convey our gratitude in this regard to the officials of correctional services who held the fort thus far in managing the spread of the virus in our centers countrywide. We have, as of 7 May 2020, recorded 172 confirmed cases of COVID-19 in correctional services, and the table breakdown is as follows. Eastern Cape, Affected officials is 36. Affected inmates is 66. Fatalities is 2. We now have 58 recoveries. In the Western Cape is 52 officials, 3 affected inmates, 1 fatality. At this stage, we have no recovery that has been recorded. Gauteng, 4 officials, 8 inmates, 0 fatality, and no recovery yet recorded. The province of Limpopo, 2 affected officials, 1 recovery. The head office, 1 official, and at this stage, no recovery that has been recorded. Acts of criminals who wreak havoc in our communities are a pain in the lives of law-abiding citizens. Crimes terrorize us in our homes, workplaces, and businesses. Citizens then look up to the law to address the criminal elements that makes lives poorer. However, we are inculcating a restorative justice system. The restorative justice system sees crime as an act against the victim and shifts the focus to repairing the harm that has been committed against the victim and the community. It believes that the offender also needs assistance and seeks to identify what needs to change to prevent further reoffending. We want to emphasize that behind the correctional center's walls, offenders are being rehabilitated. There are programs which are aimed at correcting offending behavior, aid human development, and promote social responsibility and positive social values. Through our rehabilitation programs, inmates are provided with life skills, empowered to abhor their previous lives of crime, and are prepared for a second chance in life upon their release. As part of implementing rehabilitation programs and self-sustainability model in the departments, inmates across the country are through our production workshops and agricultural farms doing agriculture. They are also doing manufacturing of furniture and also their own uniform. We have 19 textile workshops, 10 steel workshops, 10 wood workshops, 9 bakeries, and 1 shoe factory. Our workshops specialize in wood machining, upholstery, welding, plate metal work, fitting and turning, spray painting, powder coating, sign writing, confectionery, jig tool, and die making. Inmates gain valuable skills from the workshops, which bolster their employment prospects and opportunity to establish their own businesses upon release. For the 2019-2020 financial year, we have produced 3,702 loaves of bread, 6,378 and 568 liters of milk, 415,134 kilograms of fruits, 471 and 121 kg of red meat, 1,721 kg of pork, 539,000 kg of poultry, and 1,456 dozens of eggs. As a response to COVID-19, we will add the production of face masks in the workshops, which will significantly contribute towards the continued implementation of preventative measures in our facilities. We are also exploring producing soaps internally, and work is at an advanced stage in this regard to get the specifications and ensure that the soaps is in line with the guidelines of the Department of Health and the South African Bureau of Standards. These are some of the activities that contribute to rehabilitations of inmates and prepare inmates for their release. As you will recall, a special remission of sentences was announced by His Excellency President Ramaphosa on the 16th of December 2019, effectively releasing 14,647 low-risk inmates to community corrections. The inmates were granted special remissions of 12 months, and those who were classified as low risk received additional 12 months. This reduced overcrowding in our centers by 8.99%. Already, some of these individuals have been removed from the community corrections system after completing their sentences. Inmates who were serving sentences of sexual offenses, child abuse, murder, attempted murder, armed robbery, sedition, high treason, sabotage, terrorism, offenders declared as dangerous by the court in terms of Section 286A of the Criminal Procedure Act 51 of 1977, offenders sentenced to life imprisonment, violations under the Domestic Act 1998, Act number 116 of 1998. Any escaped, absconded inmate who evaded the justice system after being released on bail pending appearance and was still at large on the 16th of December 2019. Those certified as mentally ill and detained in accordance with the Mental Health Act of 2002 were excluded from the remission of sentence process. The same category of exclusion applied to the COVID-19 parole dispensation the President has announced. It is imperative to inform South Africans that of the 14,647 inmates who were released, 99% have not violated their parole conditions thus far. It is only a fraction that undermined our efforts and re-offenders. There are 50 in total. The law has already dealt with some of them and a process is underway to deal with others. We acknowledge that the special remission reduced overcrowding in our centers, but unfortunately, we still have a high percentage of overcrowding, which currently stands at 32.58% as of 4 May 2020. We have a total of 157,208 inmates, whereas our accommodation capacity is 118,572. This number includes a total of 56,536 inmates who are in remand detention. This means our accommodation capacity is exceeded by 38,636 inmates. In our regions, the Eastern Cape has the highest percentage of overcrowding at 54.88%. Gauteng follows with 52.10%. Limpopo, Mpumalanga and the Northwest region stands at 39.18%. Western Cape stands at 29.8%. KwaZulu-Natal stands at 25.97%. And Free State and Northern Cape region is at 0.45%. In our biggest centers, St. Albans, Medium A in the Eastern Cape, has an occupancy level of 238.39%, with a total of 1,683 inmates, whereas its bed capacity is 706. Johannesburg, Medium A in Gauteng, has occupancy level of 251.29%, with a total of 6,609 inmates, whereas its bed capacity is 2,630. Hoshimampuru, the second locals also in Gauteng, has occupancy level of 176.55%, with a total of 3,833 inmates, whereas its bed capacity is 2,171. Can you help me with water, Chris? Paulsmo Medium B in the Western Cape has occupancy level of 218%, with a total of 953 inmates, whereas its bed capacity is 437. And Durban Medium A in KwaZulu-Natal has occupancy level of 164%, with a total of 4,102 inmates, whereas its bed capacity is 2,501. These are overcrowding challenges that confront us. Overcrowding is a multidimensional problem caused by various special challenges such as criminality, unemployment, substance abuse, poverty, amongst others. One of our mitigating factors to alleviate overcrowding was the construction of new infrastructure and upgrading of old infrastructure to increase the bed space. In 2015, we upgraded Cyril Center in the Western Cape, resulting in 282 additional beds. In 2017, we upgraded Matatiele in the KwaZulu-Natal region and Venhiersdorp in the Western Cape, resulting in additional beds of 352. In 2018, we upgraded Standerton Center in the region of Limpopo, Mpumalanga, and the Northwest, resulting in 604 additional beds. In 2019, we upgraded Edgescott in KZN, resulting in additional 309 beds. In 2020, we upgraded Maximum C in Kgoshi-Mampuru, resulting in 12 additional beds. In the next 5 years, we will create additional beds of 3,006 bed spaces through upgrades and construction of new facilities in Mtonjeni, Brandvlei, Parole, Bekersdorp, and Lichtenburg. Experience has taught us that it is not possible for our construction infrastructure project to outpace the rate of conviction due to our high crime rate as a country. The levels of crime must significantly be reduced for us to avoid overcrowding in our centers, which currently poses a great risk to both inmates and officials. The DCS also has an overcrowding strategy where we manage levels of sentence offenders through various means of spreading offenders around, of ensuring that those that can be taken to correctional supervisions go to correctional supervision, which is in the community. Reports indicate that the global prison population is estimated at 11 million, where at least 124 prisons worldwide exceed their maximum occupancy rates. The World Health Organization states that prisons all over the world can expect a huge mortality rates from COVID-19, as many of them are overcrowded. This is attributed to the fact that the virus spreads quicker in closed spaces. Another exacerbating factor is that some of the inmates already have compromised immune system as a result of chronic conditions or other underlying diseases. This makes them more vulnerable to COVID-19 and can have catastrophic effect to inmates, officials, communities around the correctional centers, as well as the broader public. As we have seen, correctional centers' walls do not prevent the spread of COVID-19. It is also likely that infections in our centers can be transmitted from our centers into society at large, as officials regularly interact with their loved ones in their communities and offenders interchangeable. This could occur despite the fact that we are operating under a contagious disease protocol. The World Health Organization acknowledges that an outbreak of COVID-19 in prisons threatens peoples even outside prisons. In line with this observation, most countries across the globe released inmates who are close to serving their minimum detention periods and were sentenced for non-violent crimes to avoid the COVID-19 rampage. Countries like Turkey, Iran, France, Italy, Eritrea, Cameroon, to mention but a few, have during the outbreak of the virus released inmates to ease overcrowding in their facilities. Inaction on our part will put lives of officials, the broader population and offenders at great risk as COVID-19 cases continue to rise. It is against this background that we promoted with the President to place selected category of low-risk offenders in the community correction system. This was in accordance with Section 842J of the Constitution, which gives the President the responsibility for pardoning or reprieving offenders, remitting any fines, penalties, or forfeitures. In addition, Section 821A of the Correctional Services Act empowers the President to any given time authorize the placement on correctional supervision or parole for any sentenced offender, subject to conditions that may be recommended by the correctional supervision and the parole boards. Therefore, in line with Section 821 of the Correctional Services Act, the President has authorized the consideration of parole for a selected low-risk qualifying sentence offenders who have or will reach their minimum detention periods in the next 5 years by the parole boards. The parole boards will make their decisions independently. The President's decision only allows these low-risk offenders to be considered for parole by the parole boards, because there is no any other section of the Correctional Services Act that can allow us to place offenders for consideration of parole prior to them meeting their minimum detention period. Hence this dispensation. It will be done in phases and most vulnerable. As such, those with underlying health problems, adults aged above 60 years, and female offenders with infants will be prioritized. Approximately 19,000 inmates across the country will qualify for this consideration by the parole boards. If they meet the minimum requirements, then the parole boards will attend to their release with certain conditions. They will be considered on a case-by-case basis, and those who qualify will be placed on parole after all due processes, including victim-offender dialogues, have accordingly unfolded. This process will also include a comprehensive screening process for inmates, including but not limited to taking of their fingerprints and DNA samples by the South African Police Service, and soliciting inputs from departmental social workers and criminologists, which is a critical criteria for placement on parole. And we must state that these discussions with the victims and other methods, most of it will have to be done electronically because of the requirements of social distancing. We want to emphasize that this process is different from the remission, which was applied in 2019, where offenders' sentences were remitted, meaning their sentences were reduced, in that case by 12 to 24 months. Once completed, this process is expected to reduce overcrowding by 12.15%. Should they be considered by the parole board and be granted parole? This reduction will be important from a clinical perspective, as overcrowding affects the quality of oxygen circulation within the cells, and this contributes to the speedy spread of the virus thereof. The DCS will implement further preventative measures to safeguard those remaining under our care. We want to emphasize that this process is different. Oh, it seems as if this is a repetition. The current process entails bringing forward the period of offenders' dates of consideration of parole placement, and it does not alter the sentence that inmates receives. All the inmates placed on community corrections are expected to abide by conditions that parole boards will impose upon them. In our context, awaiting trial detainees contribute significantly to overcrowding. Our analysis at this stage has revealed that a considerable number of awaiting trial detainees find themselves incarcerated because of their socio-economic conditions. There are 5,000 inmates who are currently in detention due to their inability to post bail. We are looking at intervention measures that could be implemented for these inmates, working together with other relevant stakeholders. We are not oblivious to the concerns of society towards releasing offenders before their expiry dates. We arrive at this decision after careful consideration of facts before us. This measure is aimed at protecting the entire spectrum of South Africa from the COVID-19 pandemic. We cannot afford to falter. We must flatten the curve and err on the side of caution. Should the parolees display behavior that is in conflict with the law and erodes public confidence on their rehabilitation, we will not hesitate to revoke their parole and incarcerate them. This is a conditional parole. We know of parolees who violated their conditions of release and caused unbearable pain to society by committing heinous crimes. Their actions highlighted the inefficiencies of the parole system. Immediately thereafter, parole boards have met to look at the efficacy of the parole system, and they have identified strategic intervention to enhance the system. These interventions include establishing a task team of experts, criminologists, and criminal psychologists to assess efficacy of the rehabilitation programs, and identifying gaps that lead to offenders reoffending and committing heinous or violent crimes. Legislative review of the parole system and using the Western Cape as a pilot project where DCS provides names for eligible offenders for parole consideration in advance to SAPS, thereby ensuring that case management committees and correctional service parole boards have access to full information on offenders prior to them being placed on parole. Because of the urgency of this process, we will have to ensure that this is done with speed and urgently to ensure that we work with the SAPS and all relevant people to ensure that whoever is considered for a parole, all relevant information is at the disposal of the parole board. Let us work together to fight against COVID pandemic. It is a difficult task, but one we can be able to conquer. As President Ramaphosa reminds us from time to time, the situation in which we find ourselves demands courage and patience. It requires goodwill and trust between you, the citizen, and your government, and between each other. We are a resilient people. These two we shall overcome. Akens.
Thank you, Minister, for the remarks and the outlining of the rationale of how we have come to this decision. I know that we have 7 questions on our WhatsApp line. Takalani, over to you. Can you give us those 7 questions? And then the Minister, ably assisted by the Commissioner and Judge Desai, will respond. Over to you, Takalani.
No, thanks, Crispin. The first question is from Vegas Berger. From NetFerrec24, who said, can the minister please indicate what crimes were committed by the offenders that are being released? And Alex Michley from News24 asked a couple of questions, and the first questions, what types of crimes did the offenders commit that will be considered for parole? And the next one, what criteria must have been met for these offenders to be granted parole? And the following question, has the department ascertained if they have a place to stay where they will be able to get food and water? Would someone at this address confirm that the offender will be able to stay with them for the duration of the lockdown? And the following question, we know in many cases that it's difficult to police parolees 24/7. Many of these offenders may have been incarcerated for a long time. How will you ensure that they don't move around and adhere to lockdown regulations? And Alex continues to ask a few questions again. He said, as of 7th May, there are only 77 prisoners who have tested positive for the virus. Do you expect this number to rise dramatically, which led to the need to release inmates on parole? And is the release of 19,000 offenders a sufficient measure to combat the spread of the virus, considering that prisons will still be overcrowded?
Okay, thank you. Over to you, Commissioner, then the Minister will answer.
Thank you, Minister. Oh, must I go up there? Thank you, Minister. On the first question, I think the first and the second question are the same. on what types of crimes were committed by these offenders. They were all petty crimes, and one could describe it as crimes of need that was committed by these offenders. We have ensured that we had carefully scrutinized the categories as well as the individuals to ensure that there are no violent criminals as part of this group of offenders. On the question of whether we have confirmed if these people have places of residence, it's part of the requirements when we place somebody out on parole. There need to be verification of a home address, which will be checked by the department, as well as the fact that the offender will be received by his family or the individuals at that address. On the issue of, what's the next one? On the issue of adherence, is it adherence to the conditions? We have a clear protocol in terms of monitoring and observing parolees, and where they transgress, they will be recalled on that. They will go through a process where they would be recalled. On the issue of whether the 19,000 offenders would alleviate the challenge of the virus, what I can indicate is that we expect that the virus, that there will be more offenders and officials that may be infected by the virus, because our officials and our remandees come from within society. And I think within that space, there is the opportunity of cross-contamination. So we have put in measures. We have developed revised protocols, of which there are 23. Revised standard operating procedures with accompanying protocols to ensure that we prevent and detect possible contamination of the disease. Thank you.
Just want to check, do we have Judge Desai on the line? Would he be able to take some questions?
We don't have her on the line yet.
Okay. Okay, then we'll just have to bring the minister.
Yeah, thank you. I think the Commissioner has already answered some of the questions. Whether will this be a sufficient measure, given that even with these numbers, prisons will remain overcrowded? It is, in our view, sufficient. It will give us a space, particularly to deal with the ventilation in the centers, because you will be aware that there is very low ventilation. And it also gives us a space in that when one inmate is affected, we are not dealing with the huge numbers. For example, up to now, what has saved us the current situation is that the centers where there have been outbreaks are small centers by our standards. The East London one, which the Department of Health in the Eastern Cape then agreed to test everyone in that center, all the inmates and the officials, which was a manageable number. But if this kind of a situation befall us in the Johannesburg correctional facility, which I have given the numbers here, it will also be a huge burden to the Department of Health to test more than 9,000 people, both inmates and the officials, including in Paulsmoor, or the Durban Westville. So these measures will help us in regard to the capability of our health system to manage the situation as and when it comes, because one of the strategies is containment and recover. As you have seen, we've been able to help the inmates and the officials in East London, hence we have the high rate of recovery, because it was a manageable situation, and it's a situation that could be handled. But with the other centers, it may not be the same situation, particularly the ones that we have read the numbers here. In the Johannesburg one, the Hoshmampuru, Polsmo, and Durban Westville in KwaZulu-Natal. So it does give us a space, it does give us an opportunity for that issue of a proper circulation of oxygens in the cells. But what we also do is that during the day, the inmates are taken out to do various activities so that they can be able to get oxygen, but also to work around in those in the various centers, so that they are not all of them crammed in one place. So this gives us that opportunity. The second opportunity it gives us is the places of isolation that we need as and when the inmates test positive. So we need spaces for them where they can be isolated, they can stay far from the other inmates, but we also need a space of quarantine. So we need quarantine, we need isolation. So all these measures that have been put by the department, they give us that space to maneuver. And we believe we'll be able to maneuver up until the virus reach a peak in the country, as advised by the health aspects, which could happen somewhere in July, August, or September. But at least by the time whatever happens in any part of society, as it has become clear, particularly where with the level 4 restrictions, you can already see it follows what is happening in society. In the Western Cape, the numbers are rising exponentially. And it is an important facility, it's an important issue that in our facilities, we manage this together with the Department of Health, so that we help them manage the virus for containment in society, but it also helps us that the spread is minimized, particularly when there is a positive test and everyone is tested without delay. So if you have a huge number, the testing might be constrained, because also the Department of Health has other competing interests in society. Thank you.
Thank you to those colleagues for their questions. Can I ask our radio team if we've got any callers on the line?
We don't have any caller.
We don't have any caller. Then maybe we can take the second round of WhatsApp questions.
No, thanks, Crispin. We have Tebuko Monyo from Radio Riverside. The question is, with overcrowding prevalence of 0.45% in Northern Cape prisons, will the inmates incarcerated in this province also be considered for this special parole dispensation? And Alex is asking a clarity-seeking question. Is saying, what types of crimes are considered petty crime? If you could please list these crimes. And Anthony Meyer from Pretoria FM. Can the minister please explain today's announcement with the following example? Oscar Pistorius will only be eligible for parole in 2023. Does today's announcement mean that he will now be eligible to apply for parole, given the fact that he will reach minimum detention period within the next 5 years? Or does the fact that he was found guilty of... Can you just repeat that question, please? The Oscar Pistorius one. Yes, he said, can the minister please explain today's announcement with the following example? Oscar Pistorius will only be eligible for parole in 2023. Does today's announcement mean that he will now be eligible to apply for parole, given the fact that he will reach minimum detention period within the next 5 years? Or does the fact that he was found guilty of murder still mean that he couldn't apply? And the second question from
So
Anton...
she knows the answer there.
And then will you entertain a parole application by Yanas Walus? And the two questions that I have, the remaining two is from Claudia from Business Day. Will there be any exemptions to the current parole conditions, such as seeking employment, given the economic impact of COVID-19? If so, what will be the exempted? And the follow-up question is, and by when do you aim to have an answer on what must happen to the remand detainees, as these free 5,000 people according to the numbers provided in the statement? Thanks.
Okay, thank you. Commissioner, you're up.
Thank you. I think there's a previous question that I haven't responded to related to how will we ensure that the parolees adhere to the disaster management regulations. As part of our briefing and debriefing of the parolees, we will ensure that prior to their release that they are informed as part of their conditions, that they are informed about the regulations relating to disaster management so that they are able to adhere to that. On the issue of petty crimes, here we're really looking at crimes such as minor crimes such as shoplifting, theft, trespassing. So it's really minor crimes that we are looking at in that instance. I think I'll deal with those two, Minister. I'm going to leave you the other two then. Thanks.
Thank you, Commissioner, and the viewers at home. I think, Commissioner, others, they usually say it's very difficult. The issue of petty crimes is not an easy, straightforward answer. But within our context and within the context of this dispensation is that it brings forward a person's eligibility to apply for parole. It's not like the person now qualifies. Hence, we are saying there will be due process by the parole boards to further scrutinize whether this person does qualify on a case-by-case basis, and indeed his or her release will be in the interest of justice to society. And the victims will also play a role in this regard in the process. We are going to have to devise means of how they play a role, because it will not be possible to have a clear a hearing like we normally do. So it might have to be done through electronic means, and we hope that we will be able to assist the victims to participate in the process through this kind of mediums. There were very specific questions with the hypothetical or clear cases that we might be in ourselves. Maybe I guess I could answer because it is in the public interest, and some of the names mentioned are anyway public information. Both will not qualify to apply. Mr. Pretorius and Mr. Walus, because they are the offenses that they have been found guilty of fall within the categories of exclusions as per the President's proclamation, that for some, for example, Walus is a life sentence. It's a lifer, which has got a different dispensation, which we are dealing with. As you may be aware, we have already stated our position with regard to that, and it seems as if that it might be an issue of contestations in the courts. With regard to Oscar, we are dealing with here non-violent. The low risk is also classified as those that are non-violent offenders. So that also makes him not to be eligible to apply. So the other one relates to the Northern Cape. Remember, the ideal situation will have been that we have 70% in our facilities to really be able to fight with the COVID-19. So anyone across the country in our facilities who qualifies in terms of these categories will be eligible. Even those that are in the Northern Cape with the an overcrowding, low overcrowding percentage. So that number that may be reduced in the Northern Cape will give us further space to practice physical and social distancing inside the center. But it will also give us space to also look at transferring some of the inmates in the big centers that I've mentioned to some of these areas where all protocols have been followed. So that is the procedure that we are going to follow. Thank you.
Can we just check with our judge if he's on the line yet?
No, we don't have any caller.
Okay, but there was just one hypothetical question that was asked around whether parolees would be exempted to look for jobs. And I would imagine that if you are a level 4 service provider and you're looking to employ someone, parolees also do deserve a second chance and do deserve to be employed. But of course, they would have to comply with the parole conditions that are set by the various parole boards. Yeah.
Oh, I forgot that one. I think on this question, the other important factor is that we, in terms of their conditions, parolees are expected to perform community service. So with the parole boards, they are able to allocate what community service that can be done. So in this regard, the community service will have to be limited because it's a COVID-19 situation. So some of their community service will have to be linked to the various community service activities that are happening within COVID-19, which, for example, the Department of Public Works is embarking upon, and the various things that we do, which we mentioned from the beginning. So they will still be expected to perform those community services within the limits of social distancing and within the measures that are practically possible within the level 4 restrictions.
Okay, thank you very much, Minister and Commissioner, and everyone for your kind attention. We then can conclude the press conference. Thank you very much.
Crispin Piri, the spokesperson for the Minister of Justice and Correctional Services, Ronald Lamola, wrapping up a press conference there. Of course,